A few closing comments about today's proceedings and our conference. Well, 2.5 years ago, I think 5 or 6 of us sat around a table and we thought maybe it's a good idea to have a network based on the idea of NHS networks. It was very much pushed by clinicians at the time that talks about health informatics. And 2.5 years later, we have this excellent event and this network. So when I always read our banner, connecting people, today we had a great story, 160 plus registrations, and during the day we had about 140 people attending. I think maybe the parking might have put off some people. It is always challenging to park here at work. Supporting innovation, integrating digital technology, enabling health and well-being. I think all the discussions from the opening keynote, the closing keynote, our plenary sessions, our invited speakers in the panels and the workshops, the education session, everything was about these 3 important themes we have identified in the West Midlands Health Informatics Network. So I'm very pleased to see that since the first conference we doubled in size. It was a vibrant discussion throughout the day. We had some very good quality papers, and actually at this point I will remind everybody who submitted papers that if they wish, these will be peer reviewed by the Digital Health Journal from Sage Publications, and after peer review they will be part of a special issue of the accepted abstracts for the journal. So that's another great success, and I'm very grateful to Sage Publications for allowing us to put some of our proceedings on their journal. Also, I would like to thank the HSN, the West Midlands Academic Health Sciences Network, not only for their support, but for believing in this network. And I think throughout the past few years of the HSN, this network brought everybody in the region, not only from one background. So today, I'm pleased to say that we had the academics, we had the clinicians or the NHS practitioners, we had industry, small and big, and we had also people from the region who are passionate about the 4 elements of our network. I think this is the strength of WIN. I would use the kind of usual term grassroots network, but it is indeed, it has built on over the past few years on the basis of our events, of our open network meetings, of the enthusiasm of everybody attending this and supporting the exercise. So I think it has been a great day today. It has been a pleasure to host the second WIN conference here at Warwick, and thank you very much all for coming and for participating passionately in today's proceedings. Before I close, and before I invite everybody to join us for some refreshments and some canapes and networking next door, we'll have a small reception. I would like to just mention a couple of people who I would like to especially thank for their hard work. Firstly, our network coordinator, who many of you have communicated, Martin Rowland, and I think he's hiding somewhere there, has been instrumental in supporting the IDH team in putting these events organizationally, and he has been organizing today's proceedings, the logistics, everything. So I will invite you that we congratulate him for his good. Also, I would like to thank my colleague, Dr. Sarah Lim Choi Kyung, who has been supporting me and supporting the group that did the peer reviews, the scientific part of the program. and also for communicating with all the presenters and the poster presenters and all the speakers, and for being patient with me, because I always been very critical about particular parts of the program and changing the program all the time with her. So she has been excellent, and we have a great program. Thank you, Sarah, for that. Finally, the last person that I would like to thank is my PA, because in addition to being able to deal with my hectic diary, which is, I think, only heroes can do that type of work, and keeping my sanity most of the days, she has been here and she has supported Wing and the IDH team to deliver this. So again, a special thanks to Miss Alian Edwards, who has also facilitated this event. And just to close, thank you all for coming, and I hope that we have another annual conference next year. But before that, we have an open network in March, an open network meeting as usual, and there will be a few special breakfast meetings to invite particular groups and discuss digital health and digital technologies in terms of informatics. So again, I will invite you to come to our reception, and thank you for coming.